In the tranquil, rolling countryside of Oxfordshire, England, the spring of 2020 was a period of profound uncertainty for the world. Yet, for Chloe Bennett, a 39-year-old dental nurse, it was a time for a personal decision aimed at restoring a sense of normalcy and self-confidence. Like millions of others seeking a measure of control and enhancement during a global pandemic, Chloe made an appointment for hospice therapies after hospice freedom, before without incident, lip filler injections. This choice, seemingly mundane in the realm of modern aesthetics, was one she made with the casual expectation of a subtle improvement to her appearance. She had no conceivable inkling that this routine visit to the clinic would set in motion a chain of events that would unintentionally alter the entire trajectory of her life, ultimately serving not to augment her looks, but to save her very existence by unveiling a silent, potentially fatal disease that had been lurking unseen within her body. Chloe was no novice to the world of dermal fillers. She had undergone similar procedures in the past, each time walking away with the desired plumpness and no memorable side effects beyond the typical transient swelling. This history fostered a sense of comfort and familiarity. She approached the appointment in May with the calm assurance of someone engaging in a well-understood maintenance ritual. The setting was professional. The practitioner, Dr. Brian Franks, was experienced, and the protocol was standard. However, the moment the syringe was withdrawn, an immediate and alarming divergence from the expected narrative began to unfold. Where there should have been the familiar, manageable tightness of minor inflammation, there was instead a rapid and dramatic swelling. Chloe later recalled the moment with vivid clarity in an interview, stating, "When the dermal filler went into my lip, it immediately swelled up. This was not the gradual puffiness she was accustomed to. It was an aggressive, localized reaction that seemed to defy the normal physics of such procedures." The initial swelling was just the opening act of a much more sinister performance. Within a short time, what had begun as simple inflammation morphed into a large, angry, and profoundly unexplained bruise that spread with an unsettling determination, staining the tissue both on the visible surface of her lip and on the inside of her mouth, a place where such trauma was especially unusual. The unusual nature of the reaction did not escape the trained eye of Dr. Franks. As a medical professional, his concern was instantly piqued by the presentation of the symptoms. The swelling had manifested in an area not directly associated with the injection site, a red flag that suggested an underlying physiological anomaly rather than a typical inflammatory response to the filler itself. He explained his reasoning with a clinician's precision, noting, "It appeared quite abnormal that the swelling occurred in a position of the lip not associated with the injection site. This was not the routine post-procedural edema he saw daily." It was a sign that something was fundamentally amiss with Chloe's body's ability to manage minor trauma. He did not dismiss it as an oddity, but instead urged her with firm insistence to seek immediate medical attention, stressing that her reaction was not typical and warranted a thorough investigation far beyond his cosmetic domain. His vigilance in that moment was the first critical intervention in a life-saving sequence. Returning to her work as a dental nurse, Chloe carried the visible evidence of this abnormal reaction on her face. In a healthcare environment, populated by individuals trained to observe the human body with a discerning eye, the strange bruising and swelling did not go unnoticed. It was here that the second crucial element of her salvation emerged: her colleagues. One colleague in particular, whose perspective had been tragically shaped by personal loss, having lost her own sister to cancer, saw beyond the superficial symptom. She observed that Chloe had been unintentionally losing weight, a detail Chloe herself had perhaps dismissed, or been too busy to fully acknowledge. This colleague, armed with the painful wisdom of experience, recognized the ominous constellation of symptoms: unexplained bruising coupled with unintended weight loss. She refused to let the matter rest, insisting that Chloe contact her general practitioner immediately. Chloe recalled the compelling nature of this intervention. I was at work as usual, and another colleague who had lost her sister to cancer insisted I call my GP. She said she'd noticed I was losing weight without trying, and she was worried. This push from a concerned friend and coworker was the necessary impetus to transition from concern to action. Heeding the urgent advice of both her cosmetic practitioner and her colleague, Chloe presented herself to her GP. The journey from the doctor's office to a diagnosis was a whirlwind of blood tests and anxious waiting. The results, when they came, were shocking and devastating. Chronic myeloid leukemia, or CML. This is a rare and insidious form of blood cancer that originates in the bone marrow, the very factory of life within our bones. According to organizations like the Leukemia and Lymphoma Society, CML is characterized by the uncontrolled production of abnormal white blood cells. These malignant cells, unlike their healthy counterparts, are dysfunctional and over time begin to crowd out the healthy red blood cells, platelets, and functional white blood cells, leading to a cascade of potential complications, including severe anemia, bleeding disorders, and a compromised immune system that leaves the body vulnerable to infections. For Chloe, sitting in a consultation room and hearing the word cancer attached to her name was a moment of seismic shock. It was awful, such a shock I burst into tears, she said. The human mind, upon receiving such news, often leaps to the darkest possibilities. I couldn't think of anything else except the fact that I might die, she admitted, giving voice to the primal fear that accompanies a cancer diagnosis. Yet amidst the overwhelming shock, the diagnosis also provided a terrible clarifying light. Suddenly seemingly minor and terrible to me. Suddenly seemingly minor and unconnected events from the recent past clicked into a horrifyingly coherent picture. She recalled experiencing unexplained bruising on other parts of her body, a dark patch on a thigh or a blotch on an arm, that she had attributed to simple clumsiness, the forgotten bumps and knocks of a busy life. At the time, she had not connected these isolated spots to something as systemic and serious as cancer. This is a common and dangerous pitfall, as explained by Autumn Papavallo, Head of Policy and Advocacy at Leukemia UK. She notes that the symptoms of leukemia, such as unexplained bruising, bleeding, recurrent infections, and extreme unshakable fatigue, are often frustratingly vague and easily dismissed as signs of stress, a busy lifestyle, or a passing virus. People usually don't associate these symptoms with leukemia. Papavallo stated, highlighting the critical awareness gap that Chloe's story helps to bridge. Chloe is very lucky to have been diagnosed through cosmetic surgery, she added, underscoring the extraordinary serendipity of the situation. The timing of Chloe's diagnosis, while frightening, was also profoundly fortunate. In the landscape of oncology, early detection is frequently the single most important factor in determining a successful outcome, and CML is no exception. Had the lip filler reaction not acted as a biological alarm bell, the cancer could have progressed silently for months or even years, potentially reaching a more advanced and difficult-to-treat stage. Instead, Chloe was able to begin treatment promptly. Her therapy involved oral chemotherapy, a targeted medication designed to specifically inhibit the abnormal protein responsible for the uncontrolled cell growth in CML. This treatment is not a short-term course, but a lifelong management strategy. Chloe will need to take the medication indefinitely to keep the cancer in check and prevent it from returning. The effectiveness of this modern treatment regime has been nothing short of remarkable for her. The bruising on her lip, the very symptom that started the entire ordeal, disappeared after just 1 month of medication, serving as a tangible, visible sign that the treatment was working. And Her body was responding. Chloe is now in remission, living with cancer as a managed chronic condition rather than an active immediate threat. Reflecting on the incredible journey from a cosmetic clinic to a cancer diagnosis, Chloe expresses not bitterness, but immense and profound gratitude for the bizarre series of events that saved her life. Not many people can say after having lip fillers that it saved her life, but I can, she remarked, capturing the unique irony of her situation. She is acutely aware of the role that the vigilance of others played in her survival. If Dr. Franks and my colleagues hadn't seen the swelling on my lip and pushed me to see a doctor, I would have ignored it, and it would have made treatment much harder, she acknowledged. This admission highlights a common human tendency to minimize our own symptoms, a tendency that, in this case, was overridden by the insistence of a caring professional. And personal network Chloe's story extends far beyond the confines of her personal triumph. It holds significant implications for both the cosmetic treatment industry and the broader medical community. It serves as a powerful case study in the importance of thorough patient assessment and the ethical responsibility of practitioners, even in non-medical settings, to be alert to abnormal reactions. Dr. Franks's decision to view the unusual swelling not as a minor complication, but as a potential sign of a deeper problem, was a critical piece of medical discernment. This case should remind all healthcare professionals, from cosmetic surgeons to general practitioners, to take patient concerns and unusual physiological responses with the utmost seriousness, and to always consider the full spectrum of possible causes for any given symptom. It underscores that no complaint or reaction is too trivial to investigate when it deviates from the norm. Furthermore, Chloe's experience is a clarion call for greater public health education regarding the subtle signs of serious illnesses like leukemia. Many of the symptoms are silent whispers that are easily drowned out by the noise of daily life. By courageously sharing her experience, Chloe aims to amplify those whispers, to encourage people to listen more closely to their bodies and to seek medical advice when something feels persistently off. Symptoms such as unexplained bruising, unintentional weight loss, profound fatigue that sleep doesn't cure, and recurrent infections are not just signs of burnout. They can be the body's distress signals for underlying conditions that demand attention. The emotional and psychological dimensions of Chloe's journey are equally critical. Receiving a cancer diagnosis is a life-altering earthquake that triggers a cascade of fear, anxiety, and uncertainty. Chloe's initial reaction, the tears, the fear of mortality, is a universal and valid response to such news. Her path forward, however, is a testament to human resilience. Her story speaks to the power of hope and the importance of mental fortitude in the face of a daunting illness. It also brings into sharp focus the essential need for robust mental health support for cancer patients, acknowledging that the emotional burden of the disease can be as debilitating as its physical effects. The support of her colleagues, her family, and her medical team formed a crucial network that buoyed her through the storm, highlighting that the journey through cancer is rarely walked alone. In the final analysis, Chloe Bennett's lip filler appointment became an event of profound significance, far transcending its original cosmetic purpose. It became an unintended but life-saving intervention, a diagnostic pivot point that exposed a hidden danger and gave a young woman the priceless opportunity to fight back. Her journey is a powerful and inspiring reminder that vigilance, both personal and professional, can mean the difference between life and death, and that sometimes salvation arrives through the most surprising and unexpected of channels. What began as a quest for a minor enhancement culminated in the ultimate gift, the chance to continue living. That's all about our stories. Do you have any thoughts after hearing the story? Please share it in the comments below.